Good evening, everyone, and welcome to the COVID-19 Health and Vaccination Update brought to you by the Ajax Public Library. We are so pleased that everyone could join us and our speakers for this important program. I'm Julia Campbell, Adult Services Librarian at the Ajax Public Library. Your host for this evening, along with myself, is Andrew Burley, Community Engagement Associate from the Ajax Public Library. We would like to begin this program by acknowledging that the land on which we gather is situated within the traditional and treaty territory of the Mississaugas. More specifically, the Mississaugas of Scugog Island First Nation, signatories of the Gunshot Treaty of 1788 and the Williams Treaty of 1923. The land is and will continue to be home to the Indigenous peoples. Let us acknowledge the mistakes and traumas of the past through authenticity and support truth and reconciliation. Let us engage and celebrate Indigenous communities by being leaders of action and acknowledging the United Nations Declaration on the Rights of Indigenous Peoples and the Truth and Reconciliation Commission's recommendations towards truth and reconciliation. Let us keep those principles close as we move forward with kindness and respect as a community. And now a few housekeeping items. If you experience any technical difficulties tonight, we recommend that you exit the webinar and re-enter. If you continue to have difficulties, please place a comment in the chat and a staff member will assist you. This event is being recorded and will be posted to the Ajax Library YouTube channel for follow-up viewing. Our format for this evening will begin with presentations from our two speakers and will be followed by a Q&A where your questions will be answered in the second half. If you have any questions for our panelists, please enter them into the Q&A feature. So for our first presentation, I welcome Dr. Molly Yang. Dr. Yang received her Doctor of Pharmacy from the University of Toronto, and she is the Manager of Pharmacy Innovation and Professional Affairs at Wholehealth Pharmacy Partners, a national banner of independent pharmacies. At Wholehealth, she provides ongoing clinical support for their over 150 pharmacies across Canada and leads the development of tools and resources to help pharmacists stay up to date with the latest guidelines and recommendations. She has developed pharmacy and patient-facing health promotional campaigns for key areas such as vaccinations, respiratory health, opioid safety, diabetes, and mental health. In addition to her role at Wholehealth, she also works as a clinical instructor at the Leslie Dan Faculty of Pharmacy at the University of Toronto for their International Pharmacy Graduate Medication Therapy Management Laboratories. We're very fortunate to have her with us tonight, so without further ado, I will turn it over to Dr. Yang to begin her presentation.
Thanks so much, Julia, for that introduction. And thank you to Ajax Public Library for holding the session and for the invitation to present. Let me just get my slides put up here. Okay, and just confirming that my slides can be seen. Great. Okay, so I have quite a few slides to go over this evening, so I won't do too much of a preamble. But we'll be going over the updates for COVID-19 vaccinations, focusing more so on children 5 to 11, followed by a little bit on third dose boosters as well near the end. So to start off, this is a very big picture look at the major timeline for COVID vaccines in Canada so far. The first doses of the vaccine arrived in late 2020. But in pharmacy, it wasn't until around March 2021 that pharmacists had the ability to start administering it. More recently, in September, booster doses opened up for immunocompromised patients and has since then further expanded as well. And the latest update, of course, is with the pediatric vaccines, which have become available last month. This slide goes over some background on vaccine development, which goes through several stages, each with increasing numbers of volunteers, the last stage being that continual monitoring once released. In the main study where we looked at the pediatric vaccine for children 5 to 11, similar to other vaccine studies, there was an appropriate number of children which were recruited based on the phase and given that vaccine. They found that in that study, there was a significantly reduced rate of COVID-19 and no serious side effects were found in the study as well. Now, of course, as with all vaccine studies, the number of volunteers, although in the thousands, is not powered to catch those 1 in a million side effects, which may emerge in that phase 4 monitoring stage. However, we do have an abundance of data around the world to show that COVID vaccines are safe, COVID vaccines are effective, and there are definitely no shortcuts taken to get them approved. This slide reviews the mRNA vaccines that are available in Canada. And for this presentation, I will be focusing on the mRNA vaccines as they are the first choice vaccines that are available within pharmacies at this time. All available vaccines in Canada use the spike protein, which is found on the COVID virus. These proteins are not what causes COVID, but they are present on the outside of the virus. So once your immune system recognizes the spike protein, if your immune cells come across it again, then they're primed to protect you against COVID. So with the products that we have in Canada, we have Moderna, which produces Spikevax for adults and adolescents aged 12 and up. We have Pfizer-BioNTech, which produces Comirnaty for adults and adolescents 12 and up, and their latest product for pediatrics for children ages 5 to 11. So all of the intervals for these vaccines right now are recommended to be the same at 8 weeks between dose 1 and 2. And this is on the basis of improved protection. And as well, this longer interval may reduce the risk of side effects. On the right side of this slide is just a few notes about mRNA. mRNA is present in all of us. Our cells use mRNA as instructions to build the necessary proteins that we need. The way these vaccines work is that they deliver mRNA that contains a recipe for the spike protein that we spoke about previously. Our cells use that recipe to make copies of the spike protein. So the spike protein by itself in our cells is harmless, but it's useful in this vaccine as it helps to prepare our immune cells in case they encounter COVID in the future. mRNA has actually been around for decades, and mRNA vaccines have been in studies in humans since 2013, which have shown no long-term effects. The reason why mRNA technology has not yet caught on until now is that mRNA is quite fragile, and the technology needed to transport it and produce it has been too expensive for it to be feasible in the past. However, with COVID, there's been more global funding and resources than ever seen before, which were provided in the development of these vaccines. Another important note for mRNA vaccines is that these vaccines degrade very quickly in your body. Studies have shown that the vaccine doesn't travel too far, and it should stay around the injection site, maybe moving to the closest lymph node, which are areas in your body that make your white blood cells, which are the cells that fend off those viruses, bacteria, and other microbes that can make you sick. So each ingredient in the vaccine serves a function. We have the mRNA, which of course is the recipe for spike protein, as mentioned before. We have water and salts to keep the vaccine stable at the right pH level or acidity to match your body. And we have sugar, which keeps the vaccine viable after storage in freezing temperatures. We also have lipids, which make tiny spheres that help to protect the mRNA and allow it to enter our cells. What mRNA vaccines don't contain is eggs, gelatin, gluten, latex, preservatives, antibiotics, adjuvants, or aluminum. So nothing in them that we don't need. Regarding allergies towards these ingredients, there are 2 ingredients that have are more relevant allergies. It is quite rare though, since polyethylene glycol and tromethamine are present in many products. So things like cosmetics, other medications. However, if you do have a documented allergy, it would be important to follow up with your healthcare provider about that. So differences between the adult product versus the child product. The vaccines are quite similar with the same side effects, same interval between doses recommended at the moment as well. The main differences are in the dose and the volume, with the smaller volume and dose provided for children for a more appropriate and also a smaller volume is associated with a less painful vaccine as well. The other difference in recommendations right now is that if possible, there should be about a 14-day spacing before and after receiving a children's COVID-19 vaccine, whereas adults are actually encouraged at this point to get multiple vaccines, such as their flu shot, their pneumonia shot, or the shingles vaccine at the same appointment. The reason for this precautionary recommendation right now to space vaccines for children is that we don't want to mix up any side effects between COVID-19 vaccines and other vaccines. So the question, should my child get the vaccine? I think right now it's a very critical time. It's before the holidays. We're going to be gathering soon, it's very highly recommended to get the vaccine as soon as possible, either for yourself or for your children. It's especially important if you have vulnerable people in your household, such as grandparents or seniors, if you have babies who aren't able to get the vaccine at the moment, or if you have anybody with a weakened immune system or with medical conditions. Another reason to get the vaccine is we see with the patterns with COVID-19 that cases in children and youth contribute significantly to the number of cases of COVID-19. There is the argument that a lot of children may have more mild cases than compared to older adults, but children can still get serious COVID, resulting in hospitalizations. They can get complications of COVID, and they can get long COVID as well. Another reason to get vaccinated is it'll help return back to normal. So returning to sports, to school, and other activities. In relation to that, there's also different self-isolation recommendations if you or your child are exposed to COVID-19, depending on if you're vaccinated or not. So overall, it is important to get vaccinated to protect your child, to protect yourself, to protect your loved ones and your community. And as I just mentioned, this slide goes over a graph of the age distribution across Canada, where children and youth under 18 years are significantly contributing to the amount of cases, together making up about 20% of all cases. So let's switch gears a little bit and talk about boosters. So just like other vaccines, such as your flu shot and your routine vaccines, boosters may be required after some time to make sure that your immune system is still primed and it's still ready in case it comes across COVID virus. So in how the boosters are rolled out, we really wanted to prioritize boosters to make sure that those who have weaker immune systems or those who are most at risk are getting the boost and protection first. And with the recommendations right now, it's for people who have weakened immune systems, whether that's due to a condition or due to a specific medication, and older adults. So right now it's ages 70 plus. However, starting on Monday, it'll be ages 50 plus. We have other targeted populations. And then individuals who received a full series of either 2 AstraZeneca vaccines or 1 Johnson & Johnson vaccine. So regarding the interval for immunocompromised individuals, it's at 2 months after the last dose of their previous vaccine. And then for everyone else, it's at 6 months. And I've just included this link for a date calculator from Vaccine Hunters, which I found to be quite helpful in figuring out when the best timing to make that 3rd dose appointment is. I've added this slide in here to talk about individuals who may want to delay receiving the vaccine. And this is more so for people who have COVID right now, or if they have symptoms. If you're currently self-isolating, you should delay. If you experience myocarditis or pericarditis after a previous episode of the COVID-19 vaccine, you will want to delay. And if you're being treated with antibodies or convalescent plasma, or if you had multi-system inflammatory syndrome in children in the past 90 days as well. On the right side of the slide, these patients, so those with a past COVID-19 infection, if you had a history of clot or bleeding disorders, pregnancy or breast or chest feeding, weakened immune system, and general allergies, all of these, it is still very recommended to get the vaccine, and you should be getting vaccinated. So this slide goes over some of the common side effects in the first few days after getting the vaccine. You know, I'm sure many of you have experienced this after getting your vaccines, you know, the headache, the pain, a little bit of fever perhaps, or, you know, just feeling really out of it and feeling like you need rest. This is very normal, and these side effects are common. It just means that your immune system is working, it's fighting to make sure that you're going to be protected against COVID. I've added the slide in here to talk about myocarditis and pericarditis, because it's a question that we have gotten pretty often these days. So myocarditis is inflammation in the heart muscle, and pericarditis is inflammation in the lining around your heart. These numbers on here is with, in Canada, we've provided about 23 million COVID-19 doses so far. In the case reports for myocarditis or pericarditis, it's about 500 or so. So the rate is extremely, extremely rare. We see in these cases as well, with the severity, these cases are usually very mild and there have been no deaths. We also see that the children's vaccine has a lower risk of myocarditis and pericarditis due to a lower dose and a longer recommended interval than what was initially recommended for the adult and adolescent doses, as well as a lower inherent risk in this age group. And overall, with myocarditis and pericarditis, the risk is significantly higher if you actually catch COVID than your risk with the vaccine. This slide is just a reminder that after the vaccine to continue to follow public health and safety recommendations, as no vaccine is 100% effective. So it can be definitely very difficult to get your child vaccinated. Preparing for that vaccine appointment can be quite daunting for a lot of parents. It's important to remember that preparing for the vaccine starts in advance of the appointment, where you want to hopefully set yourself up for the best appointment possible. Number one, starting with booking the optimal time, making sure that you're coming wearing comfortable clothing. If you have a child that has a history of vaccine fear, or if you have a history of vaccine fear, letting your pharmacist know so that they can book a longer time for you so you don't feel rushed. You also want to educate your child in advance about the vaccine, so telling them what to expect without using language that can trigger fear. So words like sting or prick can actually worsen their fear, but you do want to be honest with them with what they're going to be experiencing at the vaccine appointment. So you can say things like, you may feel a small pinch, but it'll be over very quickly. The vaccine only takes about 1 to 2 seconds. You can also ask your child what you can do together to prepare, whether that's bringing an item or planning a fun reward after the appointment as well. Another thing is to use available resources. So a lot of pharmacies out there carry numbing creams. This also goes into the preparation because usually these creams take about 20 to 30 minutes for them to work. And then bring, as I mentioned before, items that can help calm your child during the vaccine as well. And I've included the link to the card system below on this slide, where you can see additional resources that are available. So this slide goes over some common questions that we get. So I'll go over them quickly. So number one, what if my child is in between that 11 to 12 age range? Should they get vaccinated? Which vaccine should they get? It's still recommended to get vaccinated as soon as possible. When you go into the pharmacy, what's recommended at the pharmacy is that your child will be given the vaccine based on the age they are at the appointment. So if they're 11, they'll be getting the pediatric dose. And if they're 12, they'll be getting the adult or adolescent dose. Both of these doses are effective. And in the pediatric study, they actually matched the immunogenicity. So how effective the vaccine was in the 5 to 11 range with the lower dose compared to patients who were 16 to, I believe, 25 with the regular dose of the Pfizer vaccine as well. So very effective. The recommendation is still to get vaccinated as soon as possible. Do COVID vaccines impact fertility? No. So there's no impact on fertility, on breastfeeding or on pregnancy or breast or chest feeding. It's recommended that, to get the vaccine as soon as possible again. What about the long-term side effects of vaccines? I think we already spoke briefly about this, but for mRNA vaccines, there has not been any evidence to suggest or that would suggest that there are long-term effects. Should I or my child still get vaccinated or get a booster if I had COVID-19? Yes, you should. We don't know how long the immunity will last after you have a COVID infection, so it's still recommended that you get vaccinated, and you can do so once you have recovered. Which vaccine should I get for my second dose or booster? So if given the choice at the appointment, in the pharmacy, they'll recommend you to get the same vaccine as you had your previous dose. However, some pharmacies don't have both doses available. So at the end of the day, these vaccines are interchangeable. So if given the opportunity and the choice, then the same vaccine is what we recommend. If not, the other vaccine is just as good. And what about variants? So a question that we get a lot, since variants have and will continue to emerge. Most recently, of course, is the Omicron. I think I saw a news article just before this webinar started that confirmed that Pfizer says that their vaccine, their booster, does work against this variant. And in general, with all of the other variants, we do still see that the vaccines are retaining some of their efficacy, especially in preventing serious disease as well. So it is still recommended to get vaccinated for that. And I've included this slide as a resource slide for more information if you'd like to learn more. I've included a link here to book a vaccine on the Ontario portal, or if you'd like to visit our Wholehealth location in Durham region in Oshawa, then I've included their website here as well. And thank you so much.
Thank you so much, Dr. Yang, for your remarks and for your presentation. That was very informative. Thank you. That's much appreciated. And just a reminder that if you do have any questions for either of our presenters, you can enter them into the Q&A. So now for our second presentation, I welcome Dr. Pepi McTavish. Dr. McTavish is the Associate Medical Officer of Health with the Durham Region Health Department, and her focus at the Health Department includes infectious disease prevention and control, immunization, and sexual health. We are very fortunate to have her with us this evening, so without further ado, I will turn it over to Dr. McTavish to begin her presentation.
Well, thank you so much, and thank you so much for having me. I'll have to say I agree completely with everything said in Dr. Yang's presentation. That was excellent. And while she was presenting, I took out a few of my own slides because she's already covered it. So that's great. So thank you very much, Dr. Yang. That was excellent. Okay, so I'm just going to go through some high notes about COVID-19 recently, our cases, some updates to our data tracker so everyone knows they can go there for great information. And then we'll talk about our COVID-19 vaccines and uptake and more about the 5 to 11 bookings in Durham. And again, happy to stay on as long as needed to answer some questions. Okay. So hopefully people on the call tonight have been to our data tracker before. It's durham.ca/COVID cases. I really like this one. It's on our main page. If you go to exposure source, it tells a really good story of where we've been and sort of where we're going. So you can see we're still in the 4th wave. You can see those, 4.5 sort of humps or bumps there. So right now we are still in the 4th wave, and you can see us over to the right side there. But there's some big messages here if you're a visual person like myself. So if you take a look more to the left of this graph, there's blue. So the blue is the outbreak residents and people who live in long-term care and people who work in long-term care or retirement homes. That's the blue. So you'll notice in the 1st wave, there was a lot. 2nd wave, much less. 3rd wave, almost none. And even now we have very few cases. So this really speaks to the success of vaccination across Ontario, Canada, and especially in Durham, that our vaccines have really supported and really kept COVID-19 out of retirement and long-term care homes. And even if there's a few cases that come in, it doesn't spread like it did originally in that 1st and 2nd wave. So you can see that already just from the visuals here. And then you can also see the red. So although it's harder to see because we have less cases now, which is good, red is household contacts, and that still really drives our transmission here in Durham region. It's no surprise. COVID-19 is contagious and it spreads within households, especially if you're living with kids or older adults who you may need more close contact with. So that's a big driver of our spread, still about 50% in Durham region. I was about to say next slide, but I have control of my slides tonight. Okay, so again, this is on our data tracker. It's just a great place to go for the numbers. So we've already had over 28,000 confirmed cases since the beginning of the pandemic. Right now we're managing almost 250 active cases. And that is a lot because every day we get more cases added on, and usually by day 10, people come off our case list. But because everybody is out and about in the community, everybody's doing sports and going to the library and being places, our number of contacts for each of our cases continues to increase. It's not unusual for people to have 50, 70 close contacts, right? You go to school, you go to work, all these places. So this doesn't even really show the amount of work that is going on behind the scenes to still contain COVID-19 within Durham region. Right now we have 4 active cases currently hospitalized, and 2 of those are unfortunately in the ICU. So this gets updated every day if you want to take a look. I like seeing sort of where we've been and where we're going, like I said, from the first graph. So this rectangle on the top left, it really helps me see over the last week what our numbers have been. So we were averaging about 20 to 30 new cases a day, and we were holding quite steady in Durham region until very recently. I'm not sure why there was the blip on the 4th for decrease. There weren't really less cases that day. I think they were just sort of spread out on the other days. But we all suspect locally that we're starting to see that that increase. Hopefully we don't start to see an exponential increase with some of the modeling that came out today from the science table. But now we're up into the 40s for cases a day. So we were holding steady for quite a long time. And a lot of this was the great work residents of Durham were doing about doing their public health measures, staying home when they're sick, wearing their masks, washing their hands, whatnot, but also vaccination. So here just talks to our current outbreak. So the fact that we have 43 cases, yesterday added, we have 250 almost active cases. The fact that we only have one active long-term care or retirement home or hospital outbreak, I still think is a very large success story. Right now we have 10 school and childcare outbreaks, perhaps no surprise. Those under 11 haven't had access to vaccine for very long. It's a less immunized population, so we do see more cases and more outbreaks there. And then we have a few community outbreaks as well. But this gets updated every day, so please go there and take a look. The variants of concern, this was just added a few days ago, actually. We had it on there for the previous variants, and then we took it off because we just kept getting everything with Delta. And then lo and behold, the Omicron is back on the scene now as a new variant of concern. So it was designated a variant of concern by the World Health Organization last week on the 26th. And as of today, there's been 4 confirmed cases of Omicron in Durham region, and then the rest are under investigation. So we now have this back on our data tracker. So you can see the purple there is the Omicron. And like with the previous reporting of the variants of concern, you get a positive case. So they take your swab, it goes to the lab. They say, yes, it's positive for COVID-19, and then they do more molecular tests on it. So they'll do a screening test and they'll say, oh, I think maybe we should send this one for further testing, the whole genome sequence testing. But that's impressive science and doesn't come right away. It takes a few days, if not longer, to get that. So that's why there's all that dark gray. We just don't know yet. Those are positive cases, but we don't know yet what kind of variant they're going to be. And I can put in the chat pod too. So every day Public Health Ontario updates which health units in all of Ontario, because we all add up to be all of Ontario, have new cases of Omicron. So that's where you can see our reporting on this. So we don't really report on the cases. You can count them up when you see them on here. But we report through that Public Health Ontario report that comes out daily. So I'm happy to provide that. So what are variants of concern? They're mutations in the COVID-19 virus, the SARS-CoV-2 virus. It can make viruses more or less transmissible. They can make you sicker or less sick, or they can increase or decrease the vaccine efficacy, so how well the vaccine works. So for this one, unfortunately, we think it's more transmissible. We don't know yet if it makes people sicker, and we're not really sure yet about if it increases or what happens if you're double vaccinated or triple vaccinated. I did see the same news release that Dr. Yang saw from Pfizer. So we'll really be looking at the Ontario data just to see what that says locally about all of the cases of Omicron. So the focus right now is currently finding the cases, making sure that we contact all their high-risk contacts and really containing spread. And to Dr. Yang's point about if you're double vaccinated, usually you can sort of, if you're a high-risk contact, you can go about your business. That guidance has actually recently changed because of Omicron, and we're taking a very proactive approach. So now if you are a high-risk contact of a case that is known or suspected to be Omicron, even if you're double vaccinated, you still have to stay home and isolate now and get tested. So we know this is, it's a lot to ask people when they've, sacrificed a lot and been through a lot through the pandemic already. So we're hopeful we'll just continue to get more information and this guidance will change. But for now, that is the new guidance. So if that does happen to you, I apologize in advance because people so far, they found it a hard change because it is to stay home after you're double vaccinated. And then there'll be new federal requirements within the next few days. Where people arrive from other places from the United States will be subject to more testing and perhaps more quarantine for those 10 to 14 days once they arrive. So here we'll shift gears over to vaccination. So again, on our data tracker, it's there. You can go directly at durham.ca/vaccine tracker. There's a little widget on the main page. You can just go vaccines. So we've given almost 1.1 million doses. So this is it's excellent. When we hit the 1 million, we were very pleased. And this just shows all of our partners who have helped in Durham region to give vaccine. So you notice our pharmacy partners have done a great job and they've given over 185,000 vaccines. That's very impressive. They've done a great job. And then as for the graph here, again, I like a visual story. It's easier for me. First dose is in the light blue, so you can see everybody who got their first dose. The second dose is that medium blue. Last week, everyone came and got their second dose. And then over time, Durham did a great job of people still getting that first dose. You can see that light blue all the way. The dark blue is third doses. So as Dr. Yang said, many people were able, if they needed a booster or a third dose, to complete their primary series. And then this little tick at the end with the light blue, this is all of our 5 to 11s coming and getting vaccinated. So we'll see where this goes over time. I think that group will do very well for vaccination in Durham. But just another way to report the vaccine coverage. So we're at 89%. Those 12 plus in Durham regions have had at least one dose of their vaccine. And then those that are 12 plus who are fully vaccinated, so they've had their 2 doses, and it's now been 2 weeks after that, we're almost at 85%. So I'm very happy with this number. On the right, you can see by municipalities. You can look for Ajax and see how well Ajax is doing there. And then on the left, this is really fun to watch every day. So that top blue horizontal line, the 5 to 11, is at 23.3% now. So every day this increases. The more 5 to 11s that get vaccinated, that bar continues to grow. And a few months ago, when the 12 to 17s came on board, we weren't sure. We were watching every day, how much are they going to get vaccinated, and they've done a fantastic job. So I'm very hopeful that the 5 to 11 will catch up to the same coverage for the rest of the age cohorts. Just in case anyone is interested, so our clinics began on the 25th for the 5 to 11 group. So as of end of day yesterday on the 7th, we've given almost 14,000 pediatric doses. Again, I'm very pleased about this. The clinics have really focused on the 5 to 11 group as per provincial direction. The bulk of this, over 11,000, has been in the public health mass and community clinics, as well as our hospital partner with Lakeridge, who run a nice, very big clinic. Many school-based clinics, that was sort of after school or on PD days in certain areas that maybe have less access to the big clinics. Pharmacies come in really strong here, over 1,000 doses already. The provincial bus, the GoVax team, has come and given almost 300 doses. And then primary care is doing a great job as well of offering doses to their clients or patients. So you saw this number on the last slide, but right now it's 23.3% already of that 5 to 11 cohort who received their first dose. So we've only been doing this since November 25th. So I'm very happy with this number already in Durham. We hope it continues to increase, but this is a really good number for right now. So what vaccine are children getting? So I know Dr. Yang mentioned this, but I'll just glaze over it, but it's Pfizer. Health Canada approved it November 19th, and as she said, nothing was skipped. Nothing was, sort of fast-tracked, but nothing was skipped in that process. It's because it was a pandemic, and we wanted Health Canada to prioritize this. It's a lower dose. It's only 10 micrograms, so it's 1/3 of the dose of the adolescent or adult dose, which is 30 micrograms. And as she mentioned, the doses are given 8 weeks apart. That's the Ontario recommendation. I'll say that the vaccine, I can go over this, Dr. Yang went through it, but just like I said, nothing was skipped. All the regular safety steps were taken. They just happened quicker because we needed things to come to market, and there were not other things that Health Canada was approving at the same time. All eyes and hands were on deck here to make sure that this could happen. So it's very safe. My kids are 6 and 7, they got vaccinated on Sunday. I had no concerns about doing it. I just couldn't get a time. That was any sooner than that for 2 kids to get vaccinated at the same time. Okay, so vaccine monitoring and review. So Dr. Yang mentioned this. This is the post-marketing surveillance, and this is where your local health department, myself, comes in, because these drugs or these vaccines go to market, and sometimes it is a quicker process. You do a quick, not a quick study, but it's a study because you want to get these, you want to make sure these vaccines are safe and that they work, and then get them to market because we need them. So sometimes the post-marketing piece, so they come on board and they're allowed in Canada. So we have to see what happens after in case there's a safety signal or something that we didn't catch in a study for whatever reason. Not enough people in the study, it wasn't powered, or we just didn't catch something that you can see later on. These are called AEs, or adverse events following immunization. And these are just any reactions you wouldn't really expect to happen after vaccination. Some that you would expect, a sore red arm, but some you wouldn't expect, right? So if your arm gets cellulitis or an infection, we need to know about that because that shouldn't happen after a vaccine per se. It does happen, but that's what we watch for. So there's 2 big ways this happens. The first one is through CAFIS, the Canadian Adverse Event Following Immunization Surveillance System. And this is what you think of when you think of, you get a vaccine with your family doctor or your pharmacist, and instead of your arm just being a little bit red, your whole arm goes red, it goes down past the joint, it's itchy, it's swollen, maybe you go to a walk-in clinic to be seen, or back to your pharmacist or your family doctor. They make a report, the AFI form, they send it to local public health, we make recommendations back to your family doctor or pharmacist and to yourself about, can you get the next vaccine? Does anything different have to happen? You need to go be seen like a special immunization clinic with an allergist. And then we send that information to Public Health Ontario. Public Health Ontario sends that information to the federal government, Public Health Agency of Canada. And all this data gets tracked, and it's a very big part of vaccine safety surveillance. It's a very important piece of work we do at the health department to make sure vaccines are safe. And then the other way you can look for APs is through IMPACT, the Immunization Monitoring Program Active. So if you don't go back to your pharmacist or family doctor after you get a vaccine and you have a reaction, and let's say instead you go to hospital because your arm is red and swollen and you think you need antibiotics, and let's say a report doesn't get made by that physician because it's a busy shift and things get missed or whatever. There's many reasons sometimes reporting doesn't happen. There are special research nurses who go through these charts to make sure that there hasn't been a reaction that maybe could have been related to a vaccine. So if that happens, and we get a handful of these every month, that's another way we can get that information, so that we'll report that and we'll follow up with that individual about why did you go to emerge, what happened, have you told anybody else, does your family doctor know, et cetera, et cetera. So this is a very big piece of what we do at the health department, especially with the COVID-19 vaccines. And it gets reported on weekly, and you can see it. So Public Health Ontario reports on this weekly. The last one came out is up to reporting date of November 28th. So I can put the link to this in the chat as well. You can search, Durham comes up, all the health units come up, and as of the 28th, Durham has now had 1,932 APs, and that's good. We want APs, we want that to be reported to us. We want to look for those safety signals to make sure there's nothing that we need to report. And the most common ones you can see here, allergic skin reaction, so like a red, sort of itchy skin, maybe some hives at the site. And then the other severe or unusual events is a catch-all if things don't fit into the other categories. And things we've had recently for APs that we could think of are in this category is someone who had a strange sensation in their mouth. There was another one that had tingling, ongoing tingling on the top of their head, like sort of scalp pain, and it didn't fit into the usual AP definition for the anesthesia or paresthesia there, so it had to go into the other category. And then another one with the COVID vaccines that fits in here is menstrual changes. So if people report that they've had changes to their menstrual cycle, that would get captured in this one. So overall, there's been no safety signals in Ontario, nothing in Durham. Every single one of these comes across my desk, and the team and I make medical recommendations about can they get their vaccine again? If so, where should they get it? So I feel very comfortable, obviously I got my kids vaccinated, that there's been no safety signals of concern so far with any of the COVID-19 vaccines. Okay, so who cannot get the COVID vaccine? Dr. Yang talked about this briefly, but really if you've had a severe allergy, sort of an anaphylactic reaction to your first vaccine, the first COVID-19 vaccine, or one of the vaccine components, then you'll have to be seen by a special allergist. Doesn't mean you can't get the COVID-19 vaccine. It means you probably can't get it with us in the clinics or with your local pharmacist. We'll make sure you're seen at the special immunization clinic. And most of the time, people, if they've had a bad reaction to that first one, they can absolutely get their second dose. It's very, very, very rare you wouldn't get your second dose. Now that we have different vaccines in Ontario as well, the J&J vaccine, you can be vaccinated with a different vaccine. So I wouldn't be too concerned about that if you're concerned about getting your second one if you've had a reaction. But if you've had a reaction and you're on the call right now and no one has contacted you, you haven't told anybody, please let us know. Call our Durham Health Connection line, let your pharmacist or family doctor know, whoever gave you the vaccine, and then we'll investigate further. And then the second one here, as Dr. Yang said, it's about a delay right now. Not that you can't get it, but if you've had myocarditis or pericarditis, so that inflammation of the heart muscle or around the heart, right now there's just not enough information for NACI, that's the national body that makes recommendations about vaccines, to make recommendations to the province, for the province to make its own recommendations about those second doses. So if you had your first Pfizer or Moderna, you ended up with inflammation of your heart, right now you're just on pause while we wait the recommendations to come out to say that yes, you can get it, and you can get it house-based out. There's a little bit of waiting for these individuals. And there's a handful of people in Durham that are still waiting. How effective? Very effective. Kids have robust little immune systems. So in the big study, the big pediatric Pfizer study for kids 5 to 11, it was about 91% effective at preventing symptomatic illness. So, anything where you'd have symptoms, runny nose, cough, whatnot, 7 days after your second dose. And they did a 21-day dosing. So you got your first dose, and then 21 days later, you got your second dose. So that's 7 days after that. So we know that actually with vaccine science, if you space it out a little bit longer, you're probably going to have an even better response. So we think that it'll even look more effective when we look at the real world studies. And I think that'll be true. And just a reminder that you need to be 2 weeks after your second dose to have full protection. So it's just a little bit of information about our clinics. So our clinics are available in every municipality in Durham region. We have some school-based clinics in areas that perhaps have a little bit lower uptake usually for immunizations. And you can book this at durham.ca/vaccine appointments, or just Google Durham vaccine booking and you'll find it. It pops up. We actually have a great website. There's a clinic tour on it as well, and some little clips of some of the kiddos who've had their vaccines. So it's good. And we also list, there's a link to the pharmacy site for the provincial site where you can type in which pharmacies are offering COVID-19 vaccine. So just an FYI, some recent provincial announcements. So on the 2nd, the province accelerated the booster dose for individuals 50 and over, or certain high-risk individuals. So as you saw from the dark blue on that graph, some people have already been able to get their booster shots, but now the province is opening it up down to 50. So as of December 13th, next week, people will be able to book through many channels. I know pharmacy is going to be a big player in having people get their 3rd dose, because right now the health department clinics are still really focused on that 5 to 11 group. And then another group that was added, so effective immediately, people who receive dialysis could get their 3rd dose 56 days after their 2nd dose. And then in January, the province has let us know that they're going to start lowering it below that 50+ group. We don't know what that's going to look like yet. Is it going to be 40 and then 30 and then 20, and then what the interval will be? We've heard it's going to be 6 to 8 months right now. I'm in my 40s, so I don't know. I'll find out in January, technically when I can get my 3rd dose. And I don't know if it'll be 6 months after my 2nd dose or 8 months. So we'll have to wait and see. And then where to go for more information, our website, durham.ca/COVID vaccines, has a lot of great information. There's the link to sick kids. So if you're concerned and you can't get in to talk to your family doctor or pediatrician, questions about your kids, and if they should receive the vaccine, you can speak to a nurse at Sick Kids. And then there's the vaccine confidence line at the province. And then Scarborough Health Network actually also has another one where you can phone. If you click on that, it brings it to you, where you can talk to a nurse or a physician with vaccine questions if you can't get in locally with your own providers. And that is it for me. So I will turn it back over. Thanks.
Thank you so much, Dr. McTavish, for your presentation and for sharing all of that information, especially the Durham specific information. That's very good to know. There was one question in the chat, if Dr. McTavish could talk about the case of the child who accidentally received the adult vaccine. Oh, I think you're on mute, Dr. McTavish.
I am. I'm sorry. So I don't see the question. Can you repeat it for me?
So it's just if you could talk about the case of the child who accidentally received the adult vaccine.
Yep. So unfortunately, vaccine errors happen. Anybody who gives vaccine, we know like anything, there can be errors that happen. So I'm sorry if this has happened. The way the vaccine science is, and Dr. Yang, alluded to this, it's based on your age. It's based on your sort of immune response. It's different than some of our medicines that are more weight-based. So sometimes if we look at provincial guidance, if you're given the wrong dose, it doesn't count. And that's what happens with vaccines. If you have a small kid who's had some of their vaccines even a week before their birthday, you may have already spoken to public health about this, where it just doesn't count. And I'm sorry that that's the way it happens. That's why we're really diligent about our dates. But sometimes if someone received the wrong dose, they just need to get the other dose. So if you were 12, let's say, and you accidentally received the pediatric dose, it wouldn't count. So we'd have to give you the adult dose. But there is a very, very good, long, great document that the province put out about what if you got part of the dose. For example, what if you gave it to a child and they pulled away on their arm and you thought maybe they got half the dose? What if you thought they got 3/4 of the dose? Like, what do you do? Are you supposed to give another dose? Do you give, another half dose? So there's a really good document that we look at, that all healthcare providers who offer vaccines look at. So that's what we look at. So if someone got the wrong vaccine, we would, look to that document to see what does the science tell us about what they should do. But if you're given the wrong vaccine, we usually give you the right one right after.
Great, thank you. And there was another question in the chat. Someone said their second dose was in August and they had leukocytoclastic vasculitis. Not sure if I'm pronouncing that right now, and they are over 50. And can they get their booster before February?
So Dr. Yang could also chime in, but my understanding is this isn't one of the, unless you're on a certain medication that decreases your immunity, this right now wouldn't be one of the medical conditions that would allow you to book early.
Exactly as Dr. McTavish said, there is a clear list of conditions that healthcare providers have and medications that would make you eligible for a booster dose. If you don't meet that list at the moment, as this case would be, then you would have to wait until you could get it through another criteria, whether that be through age or other.
But just a reminder that 2 doses is really great. It's excellent. I'm, technically a healthcare provider, although I work in my home most of the time, if I'm not in our sexual health clinic. And technically I could get my 3rd dose. I maybe should go get it, but I'm very comfortable knowing that I currently have 2 doses. I feel very protected with 2 doses. So I will make my appointment, when I'm able, but I'm very comfortable getting 2 doses. 2 doses is still excellent. So thank you for getting your 2nd dose.
And Dr. Yang, I know you touched on this briefly about women who are pregnant. Is there a certain stage that women should reach in their pregnancy before receiving, let's say, a booster shot, or is it recommended for all stages in pregnancy?
Great question. So I know that, it's definitely, there's been so many changes throughout the pandemic in terms of evolving evidence that we've gotten. So I can certainly understand that there may be patients out there who are confused as to what the current state is. To my understanding, the latest evidence that we have is that COVID vaccines are safe for pregnancy in all stages and for breastfeeding or chest feeding. And so in any stage, it is really important to get that vaccine so that you're well protected. There's also been evidence that has shown that there is mothers who get the vaccine can actually pass on those antibodies to their children as well. And so it is important to get protected for yourself and also for your child.
Yep. The only thing I'll add is if people have questions, talking to their family doctor or midwife or obstetrician about when they think the timing would be if they have concerns. They get lots of those questions. They're happy to answer them. Yeah. But as soon as you're eligible to get the vaccine, you should get the vaccine. So if you find out early in pregnancy or even later, as soon as you know you're pregnant and you're able to get the vaccine, that's the recommendation.
Great, thank you. And just a question about the booster shots. Is it recommended that people have the same vaccine as they had for, let's say, the 1st and 2nd dose? Or could they potentially have a different vaccine? So let's say if they had the Moderna for the first 2, could they get the Pfizer for the 3rd? And is there any studies about whether it's more effective to do that or whether people should try to have the same vaccine each time?
That's a great question as well, since, the supply varies based on, where you get your vaccine, whether that's through a public health clinic or whether that's through certain pharmacies. And so in certain situations, patients will be faced with perhaps a choice if there's both vaccines available or perhaps only one. What we see in the recommendations, at least on the pharmacy end, is that if you're coming in for another vaccine, it's recommended to stick with the same vaccine that you had before. So if your previous dose was Moderna, then go with Moderna again. Your previous dose was Pfizer, then go with Pfizer. However, ultimately, we do have data that shows that these vaccines are what's called interchangeable. And so they are, you can use either one for the 2nd dose or for the booster if the one that you didn't use to begin with is not available at the time of your appointment.
Agree completely.
And just the last question for you, Dr. McTavish. I know the rollout recently started for children ages 5 to 11, but are there any upcoming plans to roll out the vaccine for children under the age of 5 in the near future?
That's an excellent question. So there are some countries that are already doing that. Well, yeah, I guess we'll have to wait and see. I think the push was on to look at the 5 to 11 data, and then the push was on to look at the booster data. And then I think that will come next, certainly. So if I had kids my kids are 6 and 7, if they were under 5, I certainly wouldn't hesitate if that's what Health Canada approved and NACI recommended. But we'll have to wait and see. I haven't heard any timelines yet. I feel like people are focused on the current rollout with the boosters and right now variants, unfortunately. So yeah, but I think definitely the time will come for sure.
Great, thank you. Well, that's all the questions that we've received for this evening. So I just wanted to say a big thank you to our two panelists, Dr. Molly Yang and Dr. Pepi McTavish. Thanks so much for sharing your expertise with us tonight and for providing such valuable information to our community. And thank you to our attendees for joining. This program has been recorded and will be posted to the Ajax Library YouTube channel in the next couple of days. So thanks again, and I hope everyone has a wonderful rest of their night.
Thanks for having us.
Yes, thank you.